No, it's 7. Speaking of things being expensive, right? Some people could be forced to pay $13 for a pack of cigarettes. That sounds like a lot. New York City Mayor Bill de Blasio says that he wants to raise the price. If so, that would make New York actually the most expensive state for smokers in the entire nation. The goal, get people to stop lighting up. And one place where we're talking about lighting up is, well, today is 420. Do you know what that means? That means it's Marijuana Day. That's right. Smokers celebrate marijuana. But if some Florida lawmakers get their way, not even medical marijuana patients will be able to light up. This week, lawmakers in Tallahassee, they're going to come to a compromise when it comes to medical marijuana. If there's a new bill that passes, patients won't be allowed to smoke the medical marijuana in Florida. They will have to chew it or get it some other way, ingest it some other way. Some caregivers, though, and patients say smoking the marijuana shows the greatest effects. And joining us today via Skype is Ben Pallara, Executive Director for Florida for Care. Ben, good to see you. How are you?
Thank you.
All right, you have fought to get medical marijuana passed in Florida. Voters agreed, but now the lawmakers are stepping in and making some rules. Is that going to dramatically affect the effectiveness of medical marijuana?
Well, it really depends on what version of legislation passes in this session. The House and the Senate have two very different proposals. Both of them ban smoking, as you mentioned, but the House proposal bans smoking, vaporizing, and eating marijuana, leading myself and some others to question, how do you actually consume it under the law?
Yeah, that seems to be the real issue right there. Is there some medical research that says that if you smoke it, it gets into your system in a better way, or are we just going off of the people who say it seems to work better when I smoke it?
No, marijuana certainly works better when it is inhaled. Whether or not there's a big difference between smoking and vaporizing, I don't know. But you try to meet the patients where they are. It is much easier to smoke marijuana than it is to consume it in any other way. And it's also the most effective way to do it. And it's the way that people most commonly associate with the use of marijuana.
Do you find that you're fighting a sort of an uphill battle with legislators who seem to be trying, it seems from the way you put it there, to circumvent the will of the people? People voted in medical marijuana, but they're making it almost impossible for you to take advantage of it.
Yeah, it certainly feels that way sometimes. But I think, on the Senate, Senator Rob Bradley has a proposal that bans smoking, but I think fulfills the will of the people and the letter of the Constitution in many other ways. That if Senator Bradley's proposal would pass, I would be relatively pleased with it.
Finally, do you have a strong group backing you up that can go up there and try to get this through?
Yeah, I mean, I run Florida for Care, which is kind of the offshoot of the campaigns that I ran with John Morgan for the last 4 years, and we've got a huge base of support. We've got volunteers all over the state. We had actually Tuesday in Tallahassee was Marijuana Day. There was a hearing in the Senate and a hearing in the House, and we had just dozens of people come up to give public comment there and to push public input on these bills. So yeah, we've got a great infrastructure of folks who are helping do this.
Well, it's an ongoing battle for sure, Ben, and I know a lot of people are anxiously watching your efforts and seeing what's going on up there in Tallahassee. Nice to talk to you as always, Ben. Ben Pallara, appreciate it.
Thank you so much.
You bet.